Chris Quinn from Planned Parenthood. I spent 5 years in Colorado doing tobacco control stuff, and I was wondering if you could talk about when I was out there, we faced securitization attempts every year. So I wonder if you could talk about, once TABOR's in, the effect of all these other special funds, and just in order to balance the budget, having to take all the special funds. I know a lot of us in the room see money from settlement funds or what have you. I just wonder if you could talk briefly about that.
Yeah, you got to think about the budget as a picture as two sides of the equation to balance a budget. You have your revenue side and you have your expenditure side. And in Colorado, we actually only have one side that the legislature controls, which is the expenditure side. We cannot, because of TABOR, control the revenue side. So what we do to balance the budget, because we can't actually raise any new revenue, what we do is we go out and we look for funds that are out there and rate them and take them in and balance the budget. Last year we did around, I think, $600 to $800 million in transfers from cash funds. And in that light, we can't actually have a rainy day fund. You know, they say we can, but the problem is anytime we have excess money above what the basic necessity is, we have to refund it to the taxpayers. That might be great for the taxpayers, but the next time we get into a downturn, we don't have that rainy day fund to fall back on to help make sure we can keep those offices open. And this year we're going to cut we just cut $1.4 billion this year. We're going to cut $1 billion next year. We only have a $7 billion general fund. And those are starting to cut core basic services. And so because of TABOR, because of the way we have to only look at the expenditure side, we look at cash funds to raid all the time to be able to balance the budget. We're out, actually this next year we're out of cash funds that we can use.
Are there any farmers in the room? We in essence in Colorado are eating the seed corn. So you have nothing to plant the next year because we've actually taken it about as low as it could go. Remember, you and Maine are in the same situation we're in everywhere in the United States. We're at a very low ebb in a recession as to revenues coming in. You will start from a very low point of budgetary access. You will, instead of having a budget that's up here because revenues are up here, if this passes, you will start down here and you will grow from a recession level budget, which means building up to restore anything is going to be virtually impossible.
Hi, Corinne from ASME. On behalf of both ASME and MCA and CIU, I was wondering if, I'm sure the impact has been devastating to public service unions. I'm wondering if you could just outline some of the gory details of that.
Yeah. The state used to be a good place for people to work. I mean, it used to have a benefits package that at least made it comparable to jobs in the private sector. Our benefits package has decreased year after year after year for state workers. We have state workers paying for a great deal of a portion of their health care. So much so that state workers that begin at a salary of, some of them at $24,000, can't afford to purchase the portion of health care to cover themselves and their families, which, when you consider that a state job used to be a stable job, is a really poor deal. Our highway workers that work for the Colorado Department of Transportation, my district was the I-70 corridor. If you've ever been to Colorado, it's the one that takes you to the ski areas. They're out at all hours of the day and night, scraping those highways, making sure people can get up, a pretty steep grade to the ski areas. They've been cut back. We actually had not purchased any new equipment. Although we have miles and miles and miles of new roads or expanded roads, we had no greater amount of personnel to deal with them, so they were called for mandatory overtime. And these are dangerous jobs that people are not fully awake. I'd say the quality of their working conditions has deteriorated along with TABOR, and their benefits package has been substantially reduced.
Before I came in the legislature, I was a state employee. I worked for the Medicaid agency as a budget house for them. And I came from the feds before that. The feds have actually good benefits. The state of Colorado has horrible benefits. I mean, it's not even competitive with the private sector. And the state of Colorado has one of the highest turnover rates in terms of public employees because the working conditions are so bad. You look at like the 24-hour residential care, or you look at corrections. We are literally 500 people short of the safe level of corrections officers we need in Colorado. You look at the number of injuries of corrections officers in Colorado, it's one of the highest. And it's growing every year because we have an ever-growing population in the prisons, but we don't have the staff to actually adequately do the shift changes and to do the manpower to control the population. So you're seeing more accidents, you're seeing less pay, higher turnover in state employees, and it's really causing huge problems. There's even we did performance-based pay a little while ago in our state, and there's talk about changing that. And even some Republicans think it's not working, we need to change it. But we don't have the money actually to make those changes because whatever we're going to do is going to cost some money up front to actually make those changes. And we can't do it because if we had the money, we're refunding it back to the taxpayers because we're above the TABOR limit usually.